Hey, everybody, welcome back to the Infuse Your Future podcast, where we bring together people and ideas who make the world a better place. I'm your host, Dr. C. Now, before we jump into the episode, I'd just like to invite you to check out the programs I have up on my website. I'm hosting a new boundary workshop and would love to see you there. So head on over to infuseyourfuture.com and sign up. Today, I'm excited to announce our guest, award-winning author Dr. Grace Torres-Hodges. Her book, Private Practice Solution: Reclaiming Physician Autonomy and Restoring the Doctor-Patient Relationship, just received the 2024 Independent Press Award for Medical Nonfiction. In addition to being a great doctor, she holds an MBA and has a family. Grace and I have been friends since medical school, and it's an honor to have her on the show today. So welcome, Dr. Torres-Hodges. How are you?
I'm good. Thank you so much. And it's a little reunion here online, and I love it. I'm so excited to be on your podcast. I know you've inspired many people as I've listened to your podcast. I hope I can add a little bit more here during this interview.
Yeah, absolutely. Um, so I think this book is important because medicine has gotten a little crazy, and there are a lot of doctors that are switching careers, leaving medicine. And if they're not leaving medicine, many are just struggling on a day-to-day basis to try to figure things out. So I'm curious, what prompted you to write this book and what makes you so passionate about this topic?
So the book is called Private Practice Solution because after residency, Um, one of the things that I recall everybody would ask, "What are you gonna do after residency? Where are you gonna practice?" And being the product of 2 physicians, myself, they I medicine was always somewhat destined for me. Why I think it's important is because when you and I were finishing our residencies, when someone asked a resident, "What are you gonna do afterwards?" Usually the answer was, "You're gonna open a private practice." That was the norm. In the last 15 to 20 years, that has changed tremendously. I've had the opportunity to teach residents, and that's my icebreaker question all the time. And every year, and more recently, it had become that no, I'm going to work for the hospital. I'm going to work for a group. And there were less and less people going into private practice. So that's one of the reasons why, if you read um, some of the headlines in some of the magazines today, everything talks about the negativity of private practice. You can't survive in it. Is it more than 50% of doctors are employed now, and then you hear about all the woes of those that are in private practice that are not making it financially because the reimbursement rates have been so low. So one of the reasons why I wanted to write this was because in 2013, I love medicine and I was about to give it up. I was so taken aback and just frustrated because there were so many administrative protocols. There was so much paperwork and minutia, despite the fact that we had converted all to digital and electronic. It actually ended up being more bothersome to do something that we love, and that had nothing to do with taking care of a patient. There was one day my husband asked me, "Come on, let's go. We're going out." And I said, "No, I can't. I've got this stack of papers that I took home, charts to finish, probably some audits in there also, because there's always some insurance company that was asking for additional information." And I said, "I can't do it." And he goes, "What are you working on?" And I go, "I've got to finish this paperwork." And I go, "What's your purpose in your practice?" And I go, "To provide the best foot and ankle care for my patients here in Pensacola, Florida." And he goes, "Is that helping your patient, what you're doing right now?" And I realized, none of the paperwork that we were doing had nothing to do with actually taking care of the patient. I had already taken care of the patient. And the more and more I thought about it, I'm like, why am I doing this? Why am, so you get frustrated. And then each year you saw your reimbursements going down and you were working harder in order to make up the difference. You were seeing more patients. And as a result of that, your schedules got hectic. You didn't have time for yourself, and the burnout factor comes into play. I was going through my email, and there was this email that said, how to thrive, not just survive in your private practice. And I started hearing about how people practicing medicine cash based or outside of all the insurance based protocols, and I started really looking and keeping in touch with them and found how they found their way out of it. And one of the biggest things that they said was, there's a difference between healthcare and health insurance, and that those terms have become so mixed up. Healthcare is what doctors do. It's what we provide and treat patients. Health insurance is a means. It's a means to pay. It's a currency. It's actually a risk management tool to protect patients from catastrophic loss, from healthcare expenses. But it's not the only way to pay for expenses in healthcare. And so, at any rate, I started looking at my practice and found a way to. And I started talking to my patients and found a way. The straw that broke the camel's back was I had a patient who came in who was my longstanding diabetic patient. He nicked his shin, and he tried to treat it himself, of course. And then he comes in, Dr. Grace, can you help me with this? How do I get this closed? And I looked at it, and there's an exposed tendon. And as a result of that, I said, I need to bring to the operating room. Let me get an MRI so I can see how much I need to clean out and how much may be infected. It got denied when we tried to go through the insurance route. And he was just beside himself, and he's flabbergasted. What do you mean it got denied? You know what needs to be done. And I go, hold on. It's the insurance game they have to play. Let me do this. I'm going to call the emergency room. I'm going to send you through the emergency room. I'll call my friend over there. I'll tell him what's going on. You're a diabetic. This is actually infected. We ended up doing the whole procedure, but look at the roundabout way that it took in order to get it done. That was it's incidents like that is what caused me to start thinking about doing things differently. And I went into what's called a direct care practice, which is no insurance. And my patients were very supportive of it. I lost some patients along the way, but I think what it came down to in the end was actually I knew I could do better medicine by not having this third party looking over my shoulder. That's a roundabout way of how the book came about. I started meeting up with people online through social media, and it started talking about how I found this way out, because everybody was complaining about reimbursements and new protocols for quality measures. And when you think about it, quality measures according to who? It really should be based on what the patient wants and what the patient should be getting at the end. And our doctors started reaching out to me, and they wanted to find out how to get out of insurance and still practice medicine. As a result, I was trying to teach them that, and I kept on repeating myself, and that is where a lot of the initial part of the book starts from. I grew up in a household of physicians, so I always worked in their office. It kind of came natural to me to do practice management and follow up on revenues and expenses. And long story short, all of that is also included in my book. So it comes from so many different sources: my own personal struggle, the way that I've seen how other doctors struggle, and then also from business school. So
Yeah, it's interesting. As many things are these days, the medical system is broken. Patients just want to be seen at a reasonable rate and get better, and doctors just want to see the patient. We were talking before we started this podcast about how medicine is not black and white. That's what I feel all the insurances and institutions are doing. And part of me understands why they're doing it, but they're trying to make everything black and white. If you're not a doctor, if you're a patient, you probably don't know that there's thousands and thousands of codes. And so when you come in, whatever you're coming in for has to fit into a code. And if you, heaven forbid, put the wrong code, then you may not get paid anything. Or sometimes if you do the wrong code, 4 or 5 years later, the insurance can come back and say, oh, you used the wrong code and we overpaid you. So now you have to pay us back and it's due in a month. And that can amount to thousands and thousands of dollars. And you're just out in left field. Like, why didn't you alert me to this in a timely manner?
Right. Right.
Right.
Yeah. I mean, people can't be pigeonholed. Diseases are not pigeonholed into different things. And that's what the coding tends to do. And like what you were saying, medicine's not black and white, it's not the essence of medicine is the relationship that the doctor makes with the patient, and each one's individualized. I mean, you look at even twins. There's that study, science even proves this also. Twins, even though genetically they're identical, they can respond completely different to different things. And so for a protocol to be set, there are guidelines that we follow. I get that protocol. But for them to say a protocol to treat a certain disease has to follow these steps. One of the things on that patient that I was talking about, they said they would cover the MRI if I did wound care on him for a month. He would have no leg by the time I had done wound care on him. And so one of the things about science is that you have to be able to have that autonomy, that independence to question things. And the more input you have, the better it is. The scary thing right now is that if medicine becomes pigeonholed into one way of doing things, we're not going to have those independent views to look at something and approach it from a different perspective, and that's what I'm scared of with regards to academic medicine, the residencies and employment and everything. Physician autonomy, which is a main part of the book's title, is critically important because, like you said, doctor are burning out. We don't have the resources anymore behind us. People are not there. It's not enticing to go into medicine, but if you give them a chance to be independent, they can be. We want to keep doctors in medicine because they're good people. They've invested the prime years of their lives into being in medicine, and that experience is meaningful and is worth something. But we also want to attract people into medicine. There was a statistic Medscape came out with, I think, that said 40% of doctors don't want their kids to go into medicine. That's kind of sad because there's something very noble that medicine offers, but it's an altruistic art. It's an art and a science. And art is always going to be very subjective. It cannot be just objective. And I don't. It's. I wanted to come up with a solution. It's one of the reasons why the book is called Private Practice Solution. You have to critically think. We need to have that in medicine, and if there is a protocol-driven, single way of looking at things, everybody employed, we're going to lose that. I love the old Robert Fulghum book, Everything I Needed to Know in Life I Learned in Kindergarten. And one of the things was always put things back better than you find it. I'm trying to do that in the world that we live in with medicine. We want to have good doctors. It's not going to happen if they're all following protocols only. So
That's so true. When you're in school, when you're in residency, you're taught this is how you do it. And then when you get out into the real world, especially, I don't know if you've had the opportunity to work at clinics, but when you're working in the real world, you realize that a lot of the stuff you learned just doesn't apply. And you do have to bring out that art palette
Mhm.
And that's why they call it the medical arts.
Exactly,
Because you take the
exactly.
didactical stuff you've learned and then you put your artistic spin on it, and that's how you get the good patient outcomes.
Absolutely, absolutely. Because every patient is also going to respond to you differently. I remember when we were, just coming out of residency, you're so gung ho because you're excited. You're now you're the attending. People should be listening to you. And that first time that a patient comes in and you had told them to do something like stay off your foot because I just did surgery on it, and they are walking without a surgical shoe on, and you realize, "Oh my gosh, what did you just do? Why are you coming in here?" And you get so frustrated. I remember my mom, who's a doctor also, she's a retired cardiologist. She goes and says, "You know, you're learning because our role as physicians is to advise our patients. The patients have to take care of themselves also. There has to be an accountability there. Make them aware of that." And then I remember once I started thinking of every patient like that, giving them a choice, giving them their autonomy on how to take care of themselves, giving them all their options. Also, I sleep better at night. I was able to I didn't get as frustrated with it. And actually, when we talk about autonomy for physicians, getting out of the insurance game is also autonomy for patients. It's a rigged system, and, when you think about it, the insurance company plays both sides. They're playing the doctor by limiting their network, they're defining their worth. On the patient side, they are setting the deductible, which is the threshold before they pay. They set the premium, which I don't know of any insurance company that the premiums go down. They keep going up. And for them to say that they are not practicing medicine, I have a hard time believing that because when they restrict the access, when they restrict the availability of physicians or drugs or tests because of authorizations, you're practicing medicine at that point. So it's a different way of thinking of things that we, both physicians and patients, have gotten very used to. It didn't used to be that way, but it became part of our day to day. So I'm trying to infuse some different ways of thinking in the middle of today's world.
And
It's
that's one
return
of the,
to old medicine.
sorry, that's one of the things that I love about you is that you're solution oriented.
I try
So
to be.
yeah, yeah. So you mentioned before we want to attract people to the medical field. And right now it's not that attractive.
Mhm.
So what is your solution with the practice solutions?
So for private practice is a way in which you can still maintain that independence because you are the one controlling the care that's rendered to the patient. Um, the doctor-patient relationship is so reverent in the sense that it's so intimate. These are people that are entrusting you with their health or entrusting their loved ones with their health. They're entrusting you because they know, like, and trust you. And uh, it's extremely humbling when that, you know how that feels also. Um, because you feel obliged to do the best you possibly can. Um, and when there's a third party that is in the exam room with you, it's difficult to do that. That's just the clinical component of it. Every private practice, and when I talk about the private practice solution and direct care, I'm really focusing on private practice. There is a place for institution and hospital medicine, but that's not what I'm focusing my way of moving forward. I'm looking at private practices outside of the hospital. Um,
And if I'm understanding you correctly, are you saying specifically private practices that are cash based and not insurance based?
Well, yeah, I don't know if private practices honestly will be able to survive solo or on their own, remaining in insurance-based medicine because there's so much control of how they run the clinical components of it, but also how they run the financial components of it. Every private practice physician has to consider themselves the CEO of a small business. And you have to be aware of your revenue and expenses. You have to play the market of supply and demand. However, when you have allowed a third party to control the pricing of your services, you've given away all of your ability to work with market forces in supply and demand. The insurance company is telling you when they're going to pay you, how they're going to pay you, and if they're going to pay you. So it's really a losing situation for private practitioners to stay in insurance-based medicine. But it's one of those things you can see that you're drowning in it. And I'm trying to send out that buoy and say, wake up and look and see, it doesn't have to be that way. So that's the solution I'm trying to offer. Going back to what my mom said, my role is to advise people about that.
And the other great thing about going to a private practice is you know who you're seeing when you get there.
Absolutely.
Because so many group practices now, you really have no idea. Even if you're paying a decent amount of money for insurance, you think you're seeing a doctor and you see a nurse practitioner, or you
Right,
think you're seeing Dr. A and you see Dr. B, who you've never met before.
right.
So you've explained a little bit about why it's important for a doctor to look at private practice, particularly private practice without a third party, just having patients pay directly, naming your own price and having them come in and just pay cash and not have to go through the circus of authorizations and verifying insurance and, the unprecedented number of loopholes that we have to go through just to see the patient and then get reimbursed. But what about the patient? Say there are people listening here and they're not in medicine. They don't know what's going on. They just want to go to a doctor. Their question is, well, I'm already paying for insurance, so why should I go to a private practice where I have to pay cash when I have insurance? What do you say to those people?
So the question is your insurance being good stewards of your money? That's probably the first thing I'd ask. And the reason why I would say that, I'm going to use an example of my own family. I have kids that played basketball, so they were winter sports. And so by the time they got injured in November, since we never used our plan to begin with, that's when I would need the insurance to get an MRI because they twisted their ankle or did something. I had the facility run our insurance through to see how much our copay would be on an MRI. The MRI copay was more than what the cash price would have been. And why is that? A lot of times what people don't realize is that the facility has to make up the difference, and they have to have just really a high price set already in order to make up the difference of the low reimbursements that they're getting back from the insurance company. But one of the things that I always tell patients to do is ask what the cash price is, whether it's medicines, whether it's labs, whether it's diagnostic tests. Ask yourself, are they really being good stewards? Why is it that your copay keeps going up? And like I said, it's a game that's being played. The patients are also unfortunately part of this game in which we're physicians and patients with a puppeteer of an insurance company controlling everything. The insurance company is determining your premiums. They raise your premiums every year. They never say, let's lower the premiums. Asking what the cash price is, you'll be so surprised, or ask for an itemized bill when you leave a hospital. You'll see how inflated the prices are. And when the game is being played, they control the prices. They can keep raising it, and no one pays attention to it because they just assume the card's going to pay for it or the insurance is going to pay for it. And probably when they talk about 80-20 coverage or 90-10 coverage, they'll say, oh, but 90% of your insurance is going to be covering it and you only owe 10%. 10% of what? 20% of what? There's a difference between 20% of only $100 versus 20% of $1,000. So That's how I would answer that. You know, it it it's when it comes to private practice, the majority of the things that we do in private practice are routine or, they're outpatient. Ask yourself, are you really getting the best out of it? There are a lot of other ways. Like I said, health insurance is a risk management tool to protect an individual from healthcare expenses. Yet the number one reason for bankruptcy in the United States is medical debt by those who have health insurance. Think about it like that. That tells you right there something's up, and it doesn't make
Yeah,
sense. Actually, a lot of people don't realize that there are other ways to get insurance or get coverage that are not just the major carriers. There are health sharing networks which work on more of a communal way. Everybody puts in money, and then it gets divided who needs it. There are some plans that actually the premiums that you pay, they have set, um, almost think of it like it's like setting aside budgets for certain procedures, like for routine procedures with your specialist, routine procedures for that. And it gives you the opportunity. Here's a bucket of money that you can use to see a specialist. Shop around, find the special. It's like you can shop, find the specialist, and if it's within that, great, you'll cover everything. If it doesn't cover it, you have to pay the difference. If you found it cheaper, you get to keep the difference. So there are other plans out there, but people don't realize that.
the solution that I really want to see is transparency.
Yeah, and that's a
Like,
big
I want someone to hand me a piece of paper and
Mhm.
say, this is the cost.
Right.
But unfortunately, in our system, there are so many different insurance companies and they all negotiate their own prices that it's not just that facilities are being jerks by not telling you what it is.
Mhm.
They literally cannot tell you
Right.
because there's a different price for every single different payer, which is
But if you
insane.
added what I can control is in a private practice. That's what the doctors who are in private practice can control. And direct care it's price transparent. That's one of the hallmarks of what direct care offers is that it is all the prices are delineated out there. It's an honest way of doing business.
Mhm.
It empowers your consumer, your patient, because it allows them to budget properly. They can also, one of the nice things, ironically today, so I had a patient who who had just down a little bit down economically. He paid me with eggs today, you know, which is huge when you think about it with the price of eggs today also. So I got 4 dozen eggs, um, as a payment, and he felt so happy to give me that because I was allowed you can't barter with insurance networks, but you can barter with your doctor.
I love that you bartered for 4 dozen eggs.
Yeah, it's so endearing because I love that. You can't even write off things that you want to when you know someone's down and out. You can't make a payment plan for a patient because you have to follow the insurance protocol. This just it just makes for better business. It's the way that it used to be. There's a phrase, I think it's Pavlov that said, if you want to learn a new idea, read an old book. This is an old book way of doing things, and we're just coming back to it.
I love it. At the end of each episode, I love to have a call to action for people. Do you have a call to action you'd like to share today?
I think mine's going to be ask for the cash price.
I love it.
And then one of the things that happens in my office, because I'm not contracted with any insurance, if they pay the cash price that I'm offering, which is my same price no matter what, they can attempt to get reimbursed through their out of network benefits with their insurer. Some pay, some don't, but you know what? Try it. The nice thing for me in my office, I don't have to deal with all the minutia anymore. The patient can actually see it. And I will tell you, the patients who have to go through that, they feel for you now. They feel for what doctors are going through, and they're the best ambassadors for direct care and for private practice then.
So true. So if anybody's in the Pensacola area and they want to get a hold of you, what's the best way to reach you?
As Dr. Grace and Dr. Torres-Hodges, it's Torres-Hodges Podiatry in Pensacola, Florida. TorresHodgesPodiatry.com. Our information's all online. I also mentor doctors as well who may want to escape the insurance-based practice. Reach me online on Instagram, Facebook, and Twitter, or whatever. It's X now, and LinkedIn at Dr. Grace DPM. More than happy to help find your escape.
I love that. And thank you for so much for everything you do. And thanks for publishing this book and helping bring integrity and transparency back to medicine. I really
Oh,
applaud you for that.
thank you. Thank you so much. And keep doing what you're doing here, Carla. Appreciate it. And thanks for having me on.